Okay. So the immune system produces antibodies. So as antigen comes in, antibodies are released, and then they go on a search and destroy mission. They're looking for that little bugger, literally and figuratively, that little germ. And then it finds it, it gets with it, and it kills it. And kind of what it does, and this is a little bit extra info, what it does is it kind of encircles it, and it kind of digests it. So you have the little antigen there, and the body, or I'm sorry, the body, the immune system, finds it, encircles it, and just dissolves it within itself. And really, that process is called phagocytosis. Phagocytosis. All right. Now, there are certain types of antigens, or there's a certain type of antigen called an allergen. And an allergen can set off an allergic reaction. Now, what's happening in that allergic reaction is really an excessive response. It's like overkill. Because we know when something comes into the body goes to attack it. But here you have an excessive response. It's like you're using a M1A1 Abrams tank to take out a guy with a BB gun. Like, it's overkill. It's overkill. Okay, I'll slow down a little bit. So remember, an antigen is a foreign substance that comes into the body and it sets off an immune response. And the body produces antibodies, which are proteins, which go look for that antigen and they destroy that antigen. So an antigen is a foreign substance that comes into the body, a virus like coronavirus. And remember, coronavirus that we have right now is in the family of coronaviruses. So there's other coronaviruses out there, not just this one. Okay. And so it's trying to destroy it. So something else that also comes into the body, we call those allergens. Does anyone have like seasonal allergies? Okay.
Yes, sir.
I never had them, but now that I live in El Paso, I do because of all the dirt, all the wind. And the funny thing is, I lived in Palm Springs, I didn't have that problem, and it gets pretty wind out there too, and it gets a lot hotter out there than it does here. Let me tell you, you haven't been hot until you've been in Palm Springs hot, or you haven't been hot till you've been fighting a structural fire with full turnouts and a BA in 115-degree weather.
Oh yeah.
It's awesome, let me tell you. Puts hair on your chest. Well, not for the ladies. It shows you what you're made out of. All right. So when the body reacts to that allergen, we call it an allergic reaction. However, in the case of an allergic reaction, and we're not an anaphylactic or anaphylaxis yet. when we have an allergic reaction, it really is a misdirected and excessive response by our immune system to go take care of that allergen. Now, the thing about allergic reactions is they could be systemic, means throughout the whole system, the whole body, or it could be localized. Like when you get, like a mosquito bite, for example, that's localized. Now, let's talk about a mosquito bite. What happens up to that mosquito bite, and then what happens after that mosquito bite? Anybody know? So this little mosquito goes around, bzz, bzz, bzz. You know, when you're trying to fall asleep and you hear that mosquito just buzzing around and just irritates the blankety blank out of you. So you can't see him, you just hear him and you're like swiping at everything you possibly can. And finally it lands. The little ninja mosquito. Chop, 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 chop. There's this, it's a ninja sword, the beak. So it lands on your arm, right here on the forearm. And it goes with its long beak. It licks you. And then it goes, boom. It pierces your skin and sucks out your blood. How come you didn't feel that needle's prick? Because the saliva is not an antiseptic, anesthetic. I always have to think about it because when I think too fast, I get confused. It's an anesthetic that numbs that area, kind of like lidocaine, novocaine. So it numbs that area and it pierces you. Well, after it's done its dirty deed, you notice then you start to itch and it gets red and you get that little welt. That's an allergic reaction. What are we having, or why are we experiencing that allergic reaction? Because that's what it is. So what is it? Chiquita, vente, chiquita, vente. Véngase, véngase. Got the love of my life right here in my lap. She's actually eyeing my pork chop. And I don't mean the lamb like, I mean like a literal pork chop. I was having dinner while you guys were taking your quiz. The reason being, since you guys can't figure it out, the reason we're having that allergic reaction is because most humans are allergic to the mosquito's saliva. So that's what we're having an allergic reaction to. So that's kind of minor, but nonetheless, it's a localized allergic reaction. That redness, that raised welt, the scratching, the itching, and then the scratching. Ay, chiquita, ¿por qué me estás haciendo eso? So that's what we're doing. Same thing if you get a reaction because of new soap, shampoo, laundry detergent, lotion. The last place I worked, employees used this sanitizer to wash the dishes, and a lot of them started getting reactions to the hands, and they weren't using their gloves, and then when they were using the gloves, they were getting water underneath the glove, and so that was really tearing up their hands. But all of that is allergic reaction. So, okay. Now, even with allergic reactions, the body recognizes it and it develops memory. I think the antibodies are female because they never forget anything. I'd kill myself. Yes, I pick on relationships, I pick on sexes, I pick on jobs, I pick on everybody. Nobody's safe for me. But really, antibodies remember. They remember. We have different antibodies for different things. Why do you think you needed to get, number one, your titers done, and two, possibly your shots? The titers were to detect the level of antibodies in your blood for those diseases, those 5: measles, mumps, rubella, chickenpox, and hepatitis B. So if there was enough antibodies, memory cells, then you are protected because there's enough in there to fight off those illnesses. Now, why is it that we have to get a flu shot every year if it's supposed to provide antibodies? Which it really does, but why do we have to get one every year? Other than Big Farm making a killing off of us.
Because the strain changes.
Exactly. There's different strains that come around every year. Now, like anything, and as some of you found out, they do weaken over time. For those of you under 25, did you have to redo your MMR? I'm seeing one person say yes. For the most part, under 25, you're still good. It's right around 25 when you need to get your next booster. Because remember, and for those that have kids, you know that kids start getting their MMR shots when they're little. ¿Qué pasó? ¿Qué pasó? Mi travesa. And because it weakens over time. Okay. All right. So now, speaking of female cells, so this allergen comes in. And because these cells don't forget, they were done wrong. And all of a sudden, I know, darn women, I'm just messing, Miss Jessie. I think everybody can relate to certain personalities. Like, just think about that one person that's this way. Like, I think about my sister. She never forgets anything. She'd be like, remember when we were little, I was 6 and we were at such and such a place and you did this? I'm like, I barely remember yesterday. and she can remember, what is she now 40, she's 45, so she can remember from almost 40 years ago. She really can. Anybody has any question about the past, it's like, hey Trish, who was this name? Or who are our neighbors back in 1982? Oh, in front of us we had so and so, next to us we had so and so, and it's like, damn. And that's what she did to her ex-husband too. Hey, you remember what you did 8 years ago? Remember what you did 2 years ago? I mean, she kept bringing every little detail up. So that's who I think about. Anyway, before I get myself into more trouble, I'll stop digging my hole. But that's exactly what happens when the pathogen or the allergen comes in again. Pathogens cause diseases, by the way. So this allergen comes in, the body's like, oh, I remember you. And now, just like that person that over exaggerates everything, the body's response is not just excessive, it is extreme. It is such a overreaction of a release. And that's what's causing an anaphylactic reaction. We also call that anaphylactic shock or anaphylaxis. All three terms are interchangeable. An anaphylactic reaction, anaphylactic shock, or anaphylaxis. They're having an extreme allergic reaction because it's an exaggerated response by the body to this allergen. And really what's happening is there's another protein called histamine that is being released. So, Miss Natalie, you suffer from seasonal allergies. So what are some of the signs and symptoms that you get as a result of those allergies?
Sneezing.
Okay.
Runny nose.
Runny nose. Huh? Runny eyes.
Mm-hmm.
Postnasal drip.
That too.
Yep. Eyes get nice and red. Those are the stages of anaphylaxis. Well, it's not that severe yet. So it's a bad allergic reaction. Now, anybody have severe allergic reactions to like peanuts, latex, work, kids?
Allergic to bunnies.
Bunnies? Okay. For animals, what they have is dander. Not dandruff, dander. Like little invisible hairs. And so when you touch them and they bring them up, then you bring their hands to your face, you're putting it, or especially around your nose and your eyes, it gets there and it irritates the area, and now you have an allergic reaction. Do you get a severe reaction to bunnies?
Yeah.
Okay. Are you asthmatic?
Yes, I am.
Okay. And that's one thing. Remember when we talked about asthma, that there's triggers. And then actually, I think it was like Ramon that talked about triggers. Animals are huge triggers. Grasses, pollens, dust. So springtime is horrible, isn't it, for asthmatics? And also like the seasonal allergies, hay fever. Horrible, horrible times. Anybody else have severe allergic reactions? Bee stings, you do, Miss Jessie?
I don't, but my daughter does. She has food allergies and to peanuts and tree nuts, and she's anaphylactic.
Okay. She have her EpiPen?
Yes.
Has the price gone down?
I don't think so. Well, not the last time I bought it, which was like 6 months ago.
How much you paid, if I may ask?
Well, insurance covered most of it, but I still had to pay $250 for each one. Or
Yeah.
each box, I mean, because they come with two.
Mm-hmm. Yeah, actually, that's not bad because you can. They're usually some for like $500-600 for two. So, and what happens to her when she has an anaphylactic reaction?
It starts out hives and her eyes will swell shut, but within I think like 10 minutes she stops breathing.
Mm-hmm. And so hives is one of the things that we'll see. And it doesn't necessarily have to be with anaphylaxis. We could have hives with a systemic reaction. Okay. What's the medical term for hives, though? Urticaria. Urticara. Urticaria. That's the medical term for hives. Now, before we get, and we've talked about this before we get to the where your daughter can't breathe or anybody with a severe allergic reaction, or let me rephrase that, anyone with an anaphylactic reaction can experience that. So what starts to happen in the body as we start getting that anaphylactic reaction? So what is the histamine doing? Anybody?
Bronchial constriction.
Okay, what else besides that?
I know it makes it really hard to breathe.
Yeah. Okay, so we have bronchoconstriction, but there's something else too.
Isn't there three
Vasodilation.
factors?
Do what? So what starts happening? So we have bronchoconstriction and
Vasodilation.
vasodilation. As a result of that vasodilation, what is happening to the capillaries?
It's increasing the permeability.
Of what? Okay, I said what's happening to the capillaries. All right.
Yes, sir.
We have increased capillary permeability, which means what?
Start leaking.
They start leaking. And so that's going to cause what?
Swelling.
Of Swelling of what?
The cells?
No.
The airway.
Things like the airway. What else? Areas like the face, the lips, the tongue. So in the airway or in the throat, we can have what we call laryngoedema. Sorry. Laryngoedema. And you see the movie Hitch?
Yes, sir.
Okay.
Yes.
Remember when he had some fish and all of a sudden he swelled up?
Yes, sir.
That's an anaphylactic reaction. And what did he take in order to control that reaction?
Benadryl, I think.
Yep. He drank some Benadryl. The side effect of Benadryl is it makes you drowsy. Benadryl is a first generation antihistamine. What does that mean? An antihistamine blocks the release of histamine, which is what's causing the allergic reaction. So that's why they take Benadryl. And we carry Benadryl in the ambulance. I mean, not as EMTs in the pill form. I mean, advanced EMTs and paramedics, and we can give it straight into the IV. But Benadryl is the option. Now, the other thing too is now they have medicines that are not drowsiness, don't cause drowsiness. Things like Zyrtec and Claritin. They are still antihistamines. And they work. Okay. So if we have vasodilation and capillary permeability, what does that mean for our blood pressure? This is important.
Is it an increase in blood pressure?
Okay, tell me why.
Because you're. Honestly, I'm not too sure.
Think about the process. Remember, we talked about this in Shock, chapter 15.
What was the question again?
Well, somebody said that the pressure is going to go up. So walk me through the process. We've talked about this before, and you're about to have an exam. So really the first question is, let's see.
Wouldn't it go down, the blood pressure?
What do you mean?
I don't know. I feel like it would go down because everything's widening or, I mean, dilating. And so there's more blood flow.
Okay. So what does that mean for the force of the contraction? So you're right. As in it's weak. Yeah, it's going to be weak. With all that vasodilation, what happens to the volume? Increase, decrease, or stay the same?
The volume stays the same.
It stays the same. Okay, so now with the blood vessels dilated, with the blood vessels dilated, how hard does the heart have to work now to push that blood?
Wouldn't the workload decrease?
Exactly. And I know we've talked about this before. Remember Starling's law? The greater the stretch, the greater the force of the contraction. With the blood vessels dilated and the volume really staying the same, but it doesn't fill the gap, is our heart having to work very hard now?
Would it have to work harder because it's not getting as much pressure, like to push through?
Exactly. So as a result, the blood pressure drops. So you see the problems with perfusing the brain? I'm spending my own money to buy something to help you guys out, hopefully. Okay. My apps. What? I just spent $35 on a lecture series and it's not in here. I guess I can't do it. Gosh dang it. I don't. I don't have to do that. All right. I'm trying to be sneaky and get all this done. That doesn't work the way I wanted it to. All right. So going back to the allergic reaction. So, and I think we talked about this the other day in the tutoring session on Sunday. When you're going to see the blood pressure drop, neurogenic shock, or actually with it's usually with the distributive shocks, isn't it? And actually, that was a good question for me to ask. Other than anaphylactic shock, what type of shock does it fall under? Because anaphylactic shock is not its own category. It's distributive shock. It's a distribution issues. The blood vessels get bigger, the blood pressure falls. So neurogenic, septic, anaphylactic, the blood pressure drops. Okay. Now, why did this anaphylactic reaction occur? Why did this anaphylactic reaction occur?
Because some sort of substance gets into our body.
I'm sorry?
We have the anaphylactic shock because some sort of substance gets into our body that we have a allergic reaction to.
Okay. All right. And so something came into our body that our body is reacting to. And then what?
We produce histamine.
Okay, the histamine's being released, but something else happened. Remember, it was a radical release or an exaggerated release of that histamine. So the body needed to figure out a way to fight it. Yeah, the way it fights it is by the release of the histamine. Well, it's trying to fight it, but it releases histamine, which causes the reaction. So we're trying to block that release. Now, had the body been exposed to that allergen previously?
Could have.
Yes, it had. Yes, it had. Because remember, it produced antibodies that remembered it. But for whatever reason, it really remembered it. See somebody getting in their car. So the next encounter or a subsequent encounter or exposure, I'm sorry, a subsequent exposure caused this reaction. Because the body already remembered it. So here's what I'm getting at. With an anaphylactic reaction, you get it after a subsequent exposure, not after the very first time you're exposed to it. In fact, it's in a subsequent exposure. What's important to remember is that anaphylactic reactions, again, number one, they will occur in a subsequent exposure. Number two, allergic reactions are not linear. In other words, they don't progressively get worse with every subsequent exposure. You could be fine the first couple times, and the next time, bam, severe anaphylactic reaction. So going back to whoever's throat closes up, or Candace's daughter, with all that laryngoedema that occurs from the extreme vasodilation. But it doesn't get progressively worse. It is unpredictable. Okay. It's unpredictable. Now, the other thing too is you may have a reaction that mimics an anaphylactic reaction. However, if it mimics it, we call it an anaphylactoid reaction. That means there's never been an exposure to it previously. So obviously it's not an anaphylactic because it occurs with a second or subsequent exposures. Man, you're tiny over there, Steve. Your head barely pops up.
Because I recline in the chair.
So what's the difference between anaphylactic and anaphylactoid? Anaphylactoid is what happens with the very first exposure. It mimics an anaphylactic, but an anaphylactic, and the other thing is that there has been no previous exposure to that allergen. Whereas anaphylactic is any subsequent exposure to that allergen. Let's see. Um, so how are the ways that an allergen can enter the body?
Ingestion, injection, inhalation, and contact.
Or absorption, yes. Remember that. The skin protects us, but there are limitations. So if you eat it, sniff it, snort it, or shoot it up, it's not going to protect you. So nose or mouth is inhalation and ingestion. So sniff it, eat it, snort it. No, snort is the same. Wait, I use sniff and snort, so that's the same thing, inhalation. Sniff it, eat it, shoot it up, or rub it on. Allergens get into the body in those ways, and really any type of antigen. So foods, pollens, medicines. Anybody ever get a reaction after getting a shot? I used to take an insulin called Levemir. And every time I used it, I didn't use it very long. I'm like, maybe it's the pen or something. No, I kept getting a reaction on my abdomen where I injected myself. That area would develop urticaria. So I know people that just being in the same room with latex start breaking out. And a good friend of mine, she has a severe latex allergy. She gets pretty anaphylactic with it. So she knows when there's been latex. And we saw it one time. We had latex in the room and we got it out, and she came in like 5 minutes later and she started breaking out because of the latex. All right. A big thing to do when you respond to a possible allergic reaction is you want to look at the scene, because are people allergic to bee stings? Yes. Are there killer bees here in Texas? And didn't they say there's killer wasps now too? What's the difference between a bee sting and a wasp sting besides pain?
Isn't a wasp bigger?
Yeah, it's a bully. But there's something else that you really have to keep in mind.
Is it the venom?
Yeah.
Well, there's different venoms. Yeah. If you
What
guys
about
don't,
the stinger?
huh?
What about the stinger?
The stinger?
Yeah.
What about it? You're on the right track.
Doesn't it, one of them, like when it stings you, it leaves something behind on your skin?
Oh yeah, the bee when it stings you, the stinger stays and it keeps pumping in the venom.
Hmm.
Okay, so how's that different from a wasp?
I don't know.
Does a wasp keep its stinger?
Okay, and what happens with a bee?
It dies when
Does
it stings people.
A bee can only sting you once. When it leaves the stinger behind, but it's also leaving its guts and the poison sac. Whereas a wasp doesn't lose its stinger. So bee can sting you once, wasp many times. Now, what's the thing about killer bees?
They attack in groups.
Uh-huh. Killer bees, when one gets pissed off at you, it's like a gaggle of something that I'm not going to say because I'll get in trouble. Now, I won't get in trouble. You guys will get mad. But a gaggle, we'll just call it a gaggle. They all come and they all start attacking you. So normally, regular honeybees, one will sting you, and that's it. You only got one sting to worry about. Killer bees, though, you piss off one, you piss off all of them. So there's been people, and they've died, of course. There's been people with over 100 stings. I remember hearing this guy and his dog, and the poor dog, I know it was over 100. I want to say several hundred times or several hundred stings. They don't care. They're very, very aggressive. Okay. So killer bees will attack in swarms. Well, wasps can too, but the killer bees are a lot more aggressive. So you have to be careful. Okay. They do like the color yellow. So if you're blonde, I'm sorry. And guess what color firefighters wear? Yellow. Man, if I didn't know any better, I'd say Gabe was a firefighter. He has the mustache and everything. Although he has a Dirk Diggler stash. All right. So you approach the scene. In your primary assessment, and I'm not talking about ABCs, your primary assessment, what are you looking for? Although you can kind of throw ABCs, but I want to know specifics.
A patent airway.
You guys are skipping 3 steps.
Could you repeat the question again, Lou?
The question is, as you approach the patient for your primary assessment, what are you looking for?
Scene safety.
Okay. Good afternoon. Hi, I'm Dr. Moore. We're here at Yale New Hampshire.
So forget all the tubes and everything and the wires. How does the patient look to you as you're approaching them? Can you see the video?
Yes, sir. Yes, sir.
Okay. How does he look to you?
Haven Hospital. How are you doing?
I'm doing okay. How are you?
I'm okay. Tell me what happened today.
So I was outside doing some yard work. I was trimming the hedges. Must have cut into a hornet's nest. A few hornets came flying out at me. I was stung by about 4 or 5 of them.
So again, look at his face. What does his face look like?
Like he's red?
Okay, he's red.
His left eye looks a little swollen.
Okay.
It looks like he might have a sting on his right shoulder.
I can't really tell, but okay.
Underneath the wires.
Does he have dots on his forehead?
Yeah, I'm seeing that. I don't know if that's from this incident or from previous. Remember respiratory emergencies. Does he look tired?
Yes, he does.
So what time of day do you think it is right now? Based on the information he gave you.
During the day.
What was that?
During the daytime.
Okay. So should he be sleepy? No. So far, do we have a good general impression? Anybody? Yes, no?
Not a good general impression, but we have one.
Okay. Well, hopefully. How does the patient look to you as you approach him? Okay, I have one. I'm looking at him. But the fact that he appears to be fatigued, drowsy. Now, did you guys, so Chief, our level of consciousness, he's tracking us. He's answering appropriately. And Chief complaint, he got stung by some wasp, right? So now we move on to the other stuff. So now what? Guys didn't notice anything?
He's hooked up to cardiac monitor.
I said ignore the wires.
Is his eyes swollen? His eyes swollen?
Somebody already mentioned that.
His breathing. His breathing.
What about his breathing?
It's shallow. It's shallow.
Okay. And what else? I want you to look at his chest. So Hannah, you started noticing that. Look at his chest. Look at his breathing.
Dr. Moore, we're here at Yale New Haven Hospital. How are you doing?
I'm doing okay. How are you?
I'm okay. Tell me what happened today.
So I was outside doing some yard work. I was trimming the hedges. I must have cut into a hornet's nest. A few hornets came flying out at me. I was stung by about 4 or 5 of them. Went inside.
Got stung by 4 or 5 of them. Damn. Shallow, rapid. Let's see what else.
Pulled the stingers out, and my cat inside started attacking me.
Mm-hmm.
After I got the cat off me, I went back
the
outside
cat.
and started
Dang cats, that's why you should never own one.
experiencing some strange feelings. I got lightheaded, dizzy, my body started tightening up.
And did you notice a rash?
I did not.
Okay.
I did not notice any of that.
Could that be where you got stung? Do you see the redness around the area?
Yes.
Here you have a little bit of modeling. You have the red and then you have the white. And that appears to be in the center, so that could be a sting. That's red. Again, sting there. Okay. When you see kind of a reddish white like that, we call that modeling also. In more severe modeling is when the person is really, really hypoxic before they turn cyanotic. So a little bit of urticaria right here. So let me ask you this. Where are you likely to see, other than the injection sites or the exposure sites, where are you most likely to see urticaria develop? So again, if you guys don't know, just say, I don't know.
I don't know.
Chest, abdomen, front of the thighs, and the back. So when somebody's complaining of getting stung by something, they're itching, check the chest, the abdomen, the thighs, and the back. Now, guys, if it's a female patient, don't get too excited. Tell them to go to the bathroom and check their legs. And then they can check their own chest too. Abdomen, you might be okay. Back, again, you might be okay. So be looking around.
You felt lightheaded. Did you have any trouble breathing?
A little at first, but nothing serious.
Did you feel any swelling in your tongue or your lips? Or
no?
Okay.
So what is that mask doing? What is that mask doing?
Giving him breathing treatment.
What was that?
It looked like it was giving him a breathing treatment.
Did you see the smoke, quote unquote, coming out of the side portals?
I thought I did.
You did. That's most likely albuterol. And you hear that constant hissing sound? That's another indication that it's albuterol.
Any real pain, I guess, from the stingers, but.
See the smoke?
Sorry, I lost my train of thought.
That's okay.
A little bit of pain from the muscles.
Was that a small seizure?
tightening up. I have a knee, left knee, lower back, and jaw problem. And when the muscles tightened up around that area, it caused a great deal of pain.
Have you ever had any problem with allergies to anything or allergic reactions to bee stings or anything?
No, I've never had a reaction to bee stings, and I have never had any reactions to any allergy-related items.
Did you actually pass out or lose consciousness?
I don't remember.
Did you call the ambulance or somebody else did?
I never called the ambulance.
Okay.
I walked outside and I believe I collapsed.
Yeah.
But I don't believe I passed out.
Okay.
Yeah. I'm just very disoriented.
You see anything abnormal here?
Blood pressure, heart rate.
So is he an anaphylactic shock?
Yes.
No.
No, because blood pressure is low, too high, right? Too high, right?
Yeah, he's really hypertensive. 151 over 118. 151 is a little high. The 118, forget about it. That is high. No. I'm worried about that blood pressure. Hopefully, as he's in a way, the albuterol can cause that, but I'd be worried as an EMT when I get that blood pressure to give him my ready report or telemedic. Yeah, that should really be sticking out. And he's only breathing at 9 times a minute, so then his breathing is not rapid; it's very shallow and slow. Heart rate's 136, which is really elevated. KG looks okay.
Yeah. Are you still feeling lightheaded at all?
A little bit.
Okay. Getting some fluids there.
Yep.
All right. Well, thank you so much for taking the time to talk to us.
So, approach a patient. Look for clues. Tripod. Remember the respiratory distress signs and symptoms? Tripoding, nasal flaring, accessory muscle use, abdominal breathing, seesaw respirations. If you listen to the lungs and the lungs show you, or if you hear wheezing, you may be able to do an albuterol treatment. Remember, you want to look at the chest, the abdomen, the back, the thighs. But again, female patients, have them check certain areas themselves. Okay. Yeah. This is where you really want to get medics out there. If the patient, like one of your classmates, they have EpiPens. If they have an EpiPen, we could assist with it. Since we didn't do pharmacology, that. EpiPen is the required treatment.
use EpiPen on someone else. If your child or someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why EpiPen should be used at the first sign or symptom of a severe allergic reaction. Just follow.
Can you guys hear it?
Yes.
Simple steps.
Thank you.
Grasp the EpiPen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of their outer thigh. Swing and push the orange tip firmly into their mid-outer thigh until you hear a click, and hold on their thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend to cover the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. The extended orange needle cover and black indicator in this window will show you that EpiPen has delivered its epinephrine. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. Anyone receiving an EpiPen injection must seek medical attention immediately. The effects of epinephrine can wear off, or a second reaction could occur. Call 911 or take the individual to an emergency room right after using EpiPen. If symptoms continue or get worse, you can use another EpiPen or EpiPen Junior 5 to 15 minutes after the first dose. Do not inject more than 2 injections right after each other. Remember to bring all the used EpiPen autoinjectors with you to the hospital. Give them to a healthcare professional for inspection and disposal. After getting medical help, stay close to a hospital or where you can easily call 911 for the next 48 hours. If you are the primary caregiver for the individual at risk, remember to ask for a new prescription for multiple EpiPen autoinjectors. Watch this video as many times as you need to learn how to use EpiPen. You can also practice with the EpiPen training device. It's very important to only use your training device when practicing. Never use your real EpiPen to practice on yourself or others. For more information about severe allergies and EpiPen, visit.
Okay, so in case they're having an anaphylactic reaction, you have to ask them if they have an EpiPen. If they do not, then there's nothing you could do. If they do, you can assist them with it, okay? They showed you how to do it on somebody else. You could also put it in their hand and swing their arm down for them to stab themselves. Believe it or not, there's been instructors that have stabbed themselves with an EpiPen. They were not careful and they actually did it. I think they actually put it into their thigh and they didn't realize it wasn't a trainer. So it will say trainer on it, okay? And there's no window to see the epi in there. Once you get hired on with an ambulance service, every year you have to go through anaphylactic training. That's a state requirement every single year. What I've done in the past, and if we're able to get back to the classroom, I will teach you how to do subcutaneous epi also, how to use a needle, how to draw it up, and how to inject it into somebody. Okay. So you can assist them with their EpiPen. You can give them albuterol. If you're working at a special event, sometimes they might have Benadryl. If not, you could always recommend that they go and buy Benadryl, but remind them that it will make them drowsy, so not to drive after taking Benadryl. or they could take Claritin, Zyrtec. There's a couple others, but those are the two big ones. I've used Claritin. I really like Claritin for allergic reactions besides Benadryl because, again, it makes people drowsy. Do you know what the ingredient is in those PM products like Tylenol PM, ZzzQuil, and that kind of stuff? The ingredient is called diphenhydramine. Do you know what the brand name of diphenhydramine is? It's Benadryl. Yeah, so they use Benadryl in these products to make you drowsy, to make you fall asleep. So, I wonder why. So, anyway, so diphenhydramine. But usually you don't carry that on an ambulance or Claritin or Zyrtec. So if you're working a special event or you're around family, then you might be able to do that. Okay. All right. Just to understand that allergic reactions can go from allergic reaction to anaphylaxis very, very quickly. I had a patient one time. I was working at a job site at a animal park, and I get called out for a person with allergic reaction, and I asked her, do you get reactions? Because she got stung by a bee, and she says yes. Okay, do you use an EpiPen? Yes. So that right away tells me that she can get bad. So I said, do you have your EpiPen? And she says, no, I forgot them at home. She's going to a wild place out in the open where there's bees in the spring, and she doesn't take her EpiPen. Okay, no big deal. So she was doing okay. She's like, I'll be fine. I'll be fine. If I need you, I'll call you back. I'm like, yes, please do. No sooner had I gone back to the office than I get called back. It took me less than 5 minutes to get back to the office. I get back, and here's this lady, or a young lady, pale, cool, diaphoretic, audible wheezes, stridor, drowsy. Are we still at allergic reaction? Nope. What are we at now? Anaphylaxis. Man, people keep disappearing. I had the whole screen full of people. Now I see like 2 empty phones or empty rooms and fewer people on camera. Okay. So anyway, I called for the ambulance. They took her to the hospital. They gave her epinephrine, but still. If somebody's having an allergic reaction, not anaphylaxis, don't cut them loose. Keep them for a while. About 15, 20 minutes is good. To make sure they don't get worse. I used to keep them about 15, 20 minutes, keep an eye on them, make sure they didn't get worse. And if they were fine after that period of time, then I cut them loose. So what she looked like was she was pale, cool, and diaphoretic. She had audible wheezing, stridor, and wheezes. Not only audible wheezes, but wheezes in her lungs as well. And drowsy. How are you going to be if you can't catch your breath? What was that?
I'm gonna be frantic or panicked.
Yeah, you can't catch your breath. So yes, most definitely. Yeah, maybe an anxiety attack. Okay. What else? So listen to the lung sounds. Look, we talk. Oh, oxygen also. If you think about it, are they lacking some oxygen? Yeah. So give them O2, like I said, assist them with the EpiPen if need be. What else? In your reassessment, listen to lung sounds. See if they're getting better. I had the last place I worked before coming back over here. We had a lady. She started having an allergic reaction. She started a new antibiotic, and she was having. Thankfully, it wasn't anaphylactic, but she was having an allergic reaction. I didn't have, and we did after that. And again, she didn't need epi because she wasn't having an anaphylactic. But I went and bought some Claritin, and I gave her some Claritin, and 20 minutes later, it started clearing up. But she was developing the swelling of the lips. She had the urticaria around her arms, her chest, her abdomen. And 20 minutes later, the swelling started going down and the urticaria started disappearing. So, okay. Now, as far as the epinephrine, you saw the EpiPen. There are 2 doses for epinephrine, the adult and the pediatric. The adult dose of epinephrine is 0.3 milligrams. And you can really give it subcutaneously or intramuscularly, sub-Q or IM. The way we normally give it as EMTs, it's through the EpiPen, which is done IM, intramuscularly. And this is a skill that you will need to be signed off in order to pass this course or finish this course. Okay. Now, the pediatric dose is half of that. Yes, 0.3 milligrams of epi for an adult. And for a child, it's 0.15 milligrams of epi.
How much is it for an adult again?
0.3 milligrams. .3 milligrams.
And that would be through IM as well?
Yes. So the Epi Junior or EpiPen Junior, that's the pediatric one. So that only has 0.15 milligrams of epinephrine. Whereas the regular EpiPen, the adult dose, has 0.3 milligrams of epi. Now, the reason epi is good for allergic reactions is that it affects both alpha and beta receptors. Remember we talked about alpha and beta back in was it shock? It vasoconstricts, alpha, and bronchodilates, beta. So it's improving the blood pressure and it's opening up the bronchioles. All right. I think that's about it. All right, any questions for me? You notice we didn't take a break? That's because we were almost done. You do have an exam on Friday, so. No? All right then. So, allergic reactions, anaphylactic reactions. There's a lot of stuff out there nowadays that people have reactions to. It could be something simple where it's localized, it rends your skin, you start breaking out in a rash, you start having some little bumps, to where systemic, it starts spreading throughout the body. There are other things that can cause an anaphylactic reaction. Most common is bee stings. Nowadays, though, a lot of people are sensitive to latex. And there's other products too, but latex seems to be a very common one, along with bee stings. People can deteriorate very, very quickly as a result. And the ones that do get bad will have epinephrine, the EpiPens. So know how to use an EpiPen, know the indication. The big thing is that you want to get to it or give it to the patient as soon as possible. Okay. Don't subscribe to that meme that says, yeah, my friend, he was dying and he gave me this thing as part of his dying whatever. And man, I don't know why he gave it to me, but I'm really appreciative. And it's an EpiPen. You know, the dude was dying of an allergic reaction. It's kind of funny, but it's also messed up. If you really think about it, it is shock, but it's also a respiratory issue. So you're going to see the things that we're already familiar with from shock and from respiratory emergencies. O2, maybe albuterol, and then we can throw epinephrine if they have it. Remember, on an ambulance, we're probably not going to carry it, although there are some that are starting to carry epinephrine. And I worked at a place where the EMTs were able to use the multi-dose vial of epinephrine. We used to carry the EpiPens, but they just got way too expensive, and they were always expiring. So went to the multi-dose Epi, which still it's like half the price, but still. So recognize that. Consider ALS, and I don't know, and that's it. Okay. Questions? Comments? Just remember, you have an exam on Friday.
The exam's going to be over all the chapters we've covered so far, or is it going to leave some of them out?
It's medical emergencies. So 16 through 21. That's 5 chapters. No, 6 chapters. Holy cow, you haven't had 6 chapters to study for since the beginning. Oh, I don't know. I don't know if it's lucky or not lucky. I might create a new test for you guys because I have been doing that if you haven't noticed. But tomorrow my day is booked. We'll see. I don't need sleep, so I could stay up all night to do your test. What do you think, Mr. Prez?
What's gonna be question count?
I don't know.
And then time, you don't know either?
No, because I don't know if I'm giving you the one I've given before or if I'm making a new one.
What's your
Is it
pass rate for the one you have?
What was that, Gabe?
The pass rate for the one you already have in play? The class is doing good on it?
No.
So we should cross our fingers?
I'd say we should study. Let me see something. All right. So me and my partner, Natalie, get dispatched. And Natalie, you're the lead. You're the lead because I'm the experienced EMT, so I like to let my partners get their hands dirty. Baptism by fire. By the way, we don't have fire because Horizon Fire is just, I'm messing, Gabe. They're busy on a fire, so they'd rather play with the fire than play with medical patients. Trust me, ask any firefighter, they'd rather go on a fire than go on a medical aid. They even did a study in Seattle and they found out that the response times were a lot quicker for fires than they were for medical aids. Oh, that was a horrible, horrible article. I don't know, you might still be able to find it online. USA Today did a big article on response times in Seattle. Did you ever hear about it, Gabe? You did? What'd you think of it?
Couldn't say it was wrong.
No. I could tell you that with medical aids, I'd take my time. I'd go to the bathroom, take care of business, and then go into the bay and get dressed or whatever. Fire, it's like, who cares? I'm wearing structured gear. I'll just pee in my pants. I never did though. Huh?
Unless we see a MVC with a vehicle rollover or possible thrown victims or CPR, I think normally we just go code 1.
Yep. No, I had to go one time and I didn't want to pee in my pants. It was a vehicle accident. And there was too many cars driving by and too many people. So it was kind of hard to just whip it out and go to the side of the hill. So I opened up 2 compartment doors and I drank a bottle of Gatorade and I peed in a bottle of Gatorade. Oh well. When you gotta go, you gotta go. All right, back to Miss Natalie and myself. I'm sorry, Mrs. Natalie and myself. So we get dispatched out to 6800 Delta for an unresponsive patient. Timeout in 1930. So I'll be the radio person because you're the patient person. No, you are the radio person, but I'll I'll do the dispatch stuff. All right. Medical one, show us that scene. Medical one, copy that scene at 1934. All right. So, here we go. We got our gear. I'm your witch. Well, it rhymes with witch. So I grab all your gear. You're super EMT. You got your tablet. You're good, right? You got your stethoscope around your neck. So, do you want to know what you're walking into?
Of course, I want to know what I'm walking into.
All right. You got a single family residence. The wife is over here. She's frantic. Oh my gosh, hurry, come here. My husband. So she guides you into the living room, and you see the guy on the sofa. Oh, I'm sorry, you see the guy on the floor. So what do you do?
Well, first, I'm going to check to make sure he's responsive.
Okay, so what are you going to do?
I'm going to be like, hey, can you hear me?
Respond. So he didn't track you, and then he doesn't respond. By the way, Sharon comes in, so we'll put her with fire. So Sharon and Marvin, they're your partners. I'm over here writing. So we got them helping out. So if you need anything, let them know.
Okay.
So he didn't respond to your, hey, are you okay? So now what?
So I'm going to check to see if he's breathing.
Wait. What's your APU?
Oh, I'm going to check his APU first.
Well, you did. You started. You're like, I said he wasn't tracking you, and he didn't respond to your, hey.
All right, is he responsive to pain?
I don't know. Have you done it?
So I'm gonna pinch his arm and see if he's responsive to pain.
How you're mean. I was waiting for you to say I'm gonna pinch his nipple. Purple nipple.
I'm not that mean.
Well, pinching the front. I'm just traumatized. I got PTSD from pinches growing up. All right, he does respond to that.
Okay, so he's responsive to pain. So I'm gonna get his vitals.
Okay. So, delegate somebody to get your vitals.
Okay. I don't remember who's helping me. Someone get me vitals.
Sharon. It was Sharon and Marvin.
Okay. Sharon will get my vitals.
Okay, what else you want to do? Ding, 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 ding.
Phone a friend. So.
Wait, that was Jeopardy theme song, not the Who Wants to Be a Millionaire theme song.
They're all game shows.
True. I'm gonna rename our. You know what? I'm gonna name our show here, our game show. The Please God Don't Let Me Kill My Patient show. Does that sound like a good name?
Sounds accurate.
The 615-829 version of Please God Don't Let Me Kill My Patient.
Okay.
So me, your partner, be like, hey partner, I'm gonna go talk to the wife, see what I can get. So you got, I still don't know which one of the two is doing your vital signs.
Sharon's doing my vitals.
Sharon's doing your vitals. All right, Sharon, can you see my chat? Or can you see the chat?
Let me check.
So I'm gonna send you vitals.
Okay.
So we've been at this a while, so let me send you the vitals.
Okay.
So, Respiratory, or RR is respiratory rate. SpO2 percentage is the pulse ox. I just sent it.
Okay, just
get confused. Huh?
okay. Yeah, it was just low. So Natalie, BP is 88/44. The pulse percentage is 132.
Just pulse.
Just pulse?
Yeah, pulse is 132.
Pulse is 132. And then respiratory rate.
It's 26. Sorry, I put an extra 2 in there.
Yeah, I was like, that's a lot.
That's like super fast.
Yeah, 226.
No,
and then
it's
they're
26.
26.
Is 26.
Okay. 26 SpO2 percent is 90%.
So your pulse ox is 90. Respiratory rate is 26. Pulse rate is 132. BP of 88/44.
Okay.
Okay.
Hey, partner. So, actually, first you talk to the patient, or to the patient's wife.
Okay. So I'm gonna ask her what's going on, what happened to him.
Well, I wasn't taking a bath, and I came out, and all of a sudden I just found him like this.
Do you know if what he was doing before you took a bath?
Well, yeah, he wanted a snack. Wait, let me see.
Is there any food that he's allergic to that you guys have in the house?
He is no allergies.
Okay. Does he?
Yeah, no allergies. So, well, all I know is he was fine when I went to take a bath. He eaten supper of pizza and then got a snack to watch some TV.
Has anything like this happened before to him?
No. So, no, nothing like this. So I'm going to show you something. All right. So you're doing your physical exam, right? The wife tells you, and this is confirmed. So let me show you this. So what is that right there?
Medical ID card.
Well, medical alert tag.
Yeah, that's what I meant.
Okay. So allergies, you see the allergies? What's the ASA?
Aspirin,
Okay. What's PCN?
penicillin,
Okay. And then you see he's allergic to cinnamon as well. All right, medical history. What's IDDM?
Insulin dependent diabetes.
Mellitus. Okay. Oh, by the way, next to him, wait, is there anything else you want to get before you keep doing your assessment and looking around?
I can't think of anything
Remember
else.
your Pierre bells.
What are you doing?
Think of your PR bells. I'm serious, guys. Those acronyms we've been going over, you need to commit those to memory. You need to commit those to memory.
So that was what? Pulse, respirations, BP, eyes.
Pulse and pulse ox. Respirations, blood pressure.
Mm-hmm. And then the eyes. The consciousness level.
Lungs or level of consciousness.
And then lungs. I think skin.
And one more for S.
Oh shit! I forgot this. Sound?
Nope. That's it. That's one of the two L's.
Yeah.
You're on the right path.
Shock. Swelling.
No, that's decap BTLS. Sugars. Is he a diabetic?
Sugars.
Is he a diabetic? Anybody? Is this patient diabetic? Okay, thank you, Marvin. So Marvin is going to say, hey, Natalie, what do you think about getting a BGL on him? So Mrs. Natalie, what are you going to say?
I want to say, yes, will you get that for me?
And you'll be able to see it. And they're going to tell you that the BGL is 144. So as you're doing the rest of your assessment, right? You're going to see, and again, as you see, so you hear audible wheezing. You feel, and he has absent radial pulses. Is that to be expected with his blood pressure? Thank you, Miss Sharon. Sharon is saying yes. Yeah, it is. And cap refills 4 seconds. So what does that tell us about his perfusion?
It's low.
It's shit. Sorry, it's low. It's horrible. All right. So again, he has a history of diabetes and high blood pressure. He takes Humalog, Lisinopril, and Lexapro. We went his vitals. When you listen to the lungs, you heard bilateral wheezes. And you notice, and remember what I told you guys, abdomen, he has hives, urticaria. So right now, give me 3 different differential diagnoses that you think is going on with him.
Could need or have low blood sugar. So
Okay, hypoglycemia.
Yeah, hypoglycemia, and then an allergic reaction.
Okay, and one more. Remember, it's just you're running hypotheses and you're doing things to rule them out. And you've already ruled out one of them. But what else could be going on with him? Heart attack?
Yes.
Maybe? Okay. So I said we ruled out one of them. Which one did we rule out? Bang, didn't you get that? Bang, that shit. Bang, that shit. My dog is so spoiled. That's what I'm doing, petting my dog. Which one have we ruled out? We said MI, we said allergic reaction, and we said.
Was it the heart attack?
And a heart. No, well, that was the MI. Hypoglycemia, MI, and what was the other one?
Hypoglycemia.
Okay, so we ruled out hypoglycemia? Hold on. Okay. So how did we rule out hypoglycemia?
His BGL reading?
Which was?
144.
Okay. So might he be having an MI?
It's possible.
Possible. Could we even say he might be having an CVA? Possible?
Yes.
Okay. So we would look at the whole body and look for any type of droop, right? Facial droop?
Yes.
Incontinence? There's no incontinence. So is there anything to support an allergic reaction?
Hives.
Hives. Now, is he having a normal allergic reaction or anaphylactic reaction? And really, we should put both of those in our differential diagnosis, shouldn't we? Okay. So we have the hives that is supporting some sort of allergic reaction. All right. So because you're a super EMT student, but I'm promoting you, you're super EMT, you look around and next to him, you have that. Brad's chocolates. Look like Christmas chocolates. Oh yeah, and he was washing it down with this. So what do you think? And I'll let you use Marvin because Marvin's been kind of quiet there. He's just in the background. Shy Marvin. He doesn't want to let anybody know that he knows. He's a quiet, shy type. How, Marvin? You're not? You're very boisterous. Boisterous. Hard to stay quiet. I could tell. So what do you think? Or are you ready to throw him in the back of the truck and get him to a hospital and hope he doesn't get worse?
I'm ruling out the allergic reaction since he's not allergic to chocolate or apples. Is that Marvin? Is that a good choice?
It also might be his first allergic reaction to it.
To what?
To chocolate or apple cider.
Why?
I'm not sure, but it might be.
Does anyone have any input for Miss Natalie?
What are the ingredients in the apple cider? Does anything have cinnamon?
Yeah, that's what I was going to say. I think there's cinnamon in apple cider, isn't there?
I don't know. Is there?
Usually there is.
Do you remember the medical alert tag? So he's already been exposed to it once before because he's had a reaction. And it's on his medical alert tag. Plus Christmas candy, could there be some with cinnamon in it?
Yes.
Possible.
Does it look like that apple cider has cinnamon?
It's hard to say. I mean,
is that what's kind of sitting like at the bottom, like settling at the
bottom of the bottle?
At what?
The bottom of the bottle.
What? Oh, that's the cinnamon at the bottom?
I don't know, maybe.
Okay.
Yes.
So based on the information they've told you, Miss Natalie, what do you think?
I'm gonna ask his wife if they have an EpiPen for him.
Nope. But we'll say he does. What would you do?
Administer the EpiPen to him.
Okay. Where would you administer it?
His thigh.
Okay. I know the video said 3 seconds. They usually teach 10 seconds. All right. Since y'all can see my screen, so are you transporting? Are you staying on scene with them? What are you doing?
Wait and see what kind of effect the EpiPen has on him before transporting him. So I'd wait.
Transport.
Wait, so you can see me.
Transport.
Transport.
All right, let's transport him. So now, so you take one of the EMTs with you, and it's Sharon because she took vitals before. So Miss Sharon, can you see my screen, my white screen?
Yes.
So you're gonna, I'll show you the vitals you're gonna tell her that you have now. It's these right here. No.
Oh.
Yeah. These right there.
Okay. Okay, so new vitals that we have is BP 106/66. Our pulse is it 126?
Uh-huh.
Okay, and then rate 18, and then our SBO 2 percentage is at 97. Pulse ox is at 97.
All right. So you're transporting. So this is advanced stuff. But only 25 Benadryl? Geez, that's low. Okay.
He's a lightweight.
There he is. So, what is your final diagnosis?
It was an allergic reaction after the EpiPen. His vitals went back up.
So was it allergic reaction or anaphylactic reaction?
Anaphylactic.
Anaphylactic. So get in there. All right. So you kind of saw, you got to look at clues. Look how your patient's presenting. But this one was a hard one. But some of you recognize that, yeah, apple cider does contain cinnamon, and he is allergic to cinnamon. Okay. It was a good example of think about your differential diagnosis and what can you prove and what can you not prove. We couldn't prove hypoglycemia because his sugar was normal. Actually, it was a little elevated, but it's not too bad having eaten some pizza and now some chocolate and some apple cider. All that stuff is sweet, and he's only at 144. It's not bad. Not bad at all. Speaking of candy, gotta get my Twizzler bits and my jelly beans. So, looking at the clues. Don't be afraid to get in there. Don't be afraid to talk. Don't be afraid to delegate. That goes for everybody. That goes for everybody. Okay? So, did you like that scenario? Did you guys like the video from earlier? The dude in the hospital? Did it kind of help paint a picture of how your patients might be presenting?
Yes.
Okay. Good. So, yeah, I'll let you guys know. I might do the new exam tomorrow. See if I get some time, because like I said, I'm booked tomorrow and I'm booked Friday morning. It's going to be more questions because it covers 6 chapters in the book. Oh, we'll see. Okay. All right. Anything else? No, not 2 parts. Your medical emergencies are already 2 parts. Can you imagine having to do the whole medical emergencies in one exam? That'd be like 120 questions. So, all right. Let me know if you guys have questions on any of this stuff. I hope I painted a good picture for you guys on anaphylactic reactions and allergic reactions. Okay. There's a website. You can also find the videos on YouTube called Khan Academy, Khan, and then Academy. They have some very good videos on a lot of different topics. So I highly recommend that if you need other study guides, use them. Don't forget to use My Brady Lab to help you. Okay. So, all right. You guys want to call it quits, or you want to go over some more stuff? Y'all are too shy. I gotta break that out of you guys. You can't be shy on this job. All right then. So I will see you guys on Friday. I will let you guys know how many questions and what time we'll get together for review after the exam. Okay?
Yes, sir.
All right, guys. You have a great night. I know I kept you way longer than you guys wanted to, but you guys have a great night, and I'll see you on Friday. Sound cool?
Yes, sir.
All right. Bye, guys.
Good night.